Sleep Equity for Global Health. This is a public-facing webinar presented by two of our Atlantic Fellows for Equity and Brain Health, who are from the Global Brain Health Institute, GBHI for short. GBHI has two sister sites, one at Trinity College in Dublin and another at University of California, San Francisco. Every year, we host a cohort of fellows from around the world who study brain health equity. And after that, they go on to be lifelong fellows who are champions for brain health equity work in their variety of disciplines. So we're very excited to hear both from them today, as well as from friends of GBHI that will be introduced later on. If we could have the next slide, please. Wonderful. I also want to acknowledge my colleague, Mary Warbelou, who is working the technology in the background. Thank you so much, Mary. So here is our variety of speakers that we have with us today. You'll see many faces from around the world who will be introduced throughout the session. And I want to extend a special thank you to Sandra Jimenez, who is a clinical neurophysiologist who is from Spain, and Tatiana Molayeva, who is a scientist and assistant professor from Canada. They have co-designed the session today, so we're grateful for them. I should also introduce myself. My name is Camelia Latte, and I am the Program Director for Alumni Relations and Special Initiatives based at our UCSF site of GBHI. Next slide, please. One of the reasons that we're having this webinar today is because it is in honor of World Sleep Day that happens every year in March. So that would be last month. And as a way of extending this recognition of the day and the importance of sleep, Sandra and Tatiana came together to organize this webinar as a follow-up to one that they had last year. You can see the history of World Sleep Day here on the slide that Tatiana kindly put together. It has quite a rich history. Next slide, please. Our agenda today is going to be brisk and hopefully very enriching for all of you. We will start with some opening remarks, followed by a talk on sleep health and equity essentials, then a talk on sleep equity, followed by lightning round perspectives, a quick audience Q&A, and some closing remarks. Next slide. And now I would like to introduce Dr. Bruce Miller, who is the A.W. and Mary Margaret Clausen Distinguished Professor in Neurology at the University of California in San Francisco, where he is the director of the Memory and Aging Center. Bruce is also the founding director of the Global Brain Health Institute. I'm going to put a link to his biography so you can read more about Bruce. And in the meantime, I would like to very much welcome Dr. Miller. And we can stop the screen share for a little bit so that Dr. Miller, we can see his face. Thank you so much, and welcome, Bruce. You're very welcome.
Thank you, Camelia. Really great to be here this morning. And thanks so much to, in particular, Sandra and Tatiana for putting together an amazing seminar. And thanks to all the participants today. I love the idea that today is a focus on equity. I think we know that this is one of the major social determinants of health. I think it was added relatively late to the risk factors for cognitive impairment with age, but I don't think that any of the risk factors are more important than this one. If you come from a low economic status community, the likelihood that you will suffer from sleep disturbance is very high, and the likelihood that it won't be treated is also high. If you come from a wealthy community, no matter how wealthy you are, if you don't sleep well, you are at major risk for neurodegenerative diseases, hypertension, death. So I think the story as it has emerged, and Sandra and Tatiana, no one leads this more than the two of you, it's pretty clear that, number one, sleep disorders impair the brain. If you have sleep apnea, the likelihood that you will have hypertension, premature death is very high. It's a massive threat to our health and to our lives. If you have disordered sleep, if you don't get into deep sleep, we now know that you don't clear the bad proteins from the brain. that accumulate with neurodegenerative disease. Further, we also know that all the processes of memory are critically important during sleep. So if you don't get into deep sleep, we know that your ability to consolidate what happened in the day before is markedly diminished. Increasingly in our clinics, we think of sleep disorders as an emergency, as something that not only must be diagnosed, but also treated. And then finally, another aspect of this story that's still emerging is that we think that degenerative diseases, all in their own different way, attack brainstem sleep systems, so that often the pattern of disordered sleep that emerges later in life may be a predictor of a specific illness like progressive supranuclear palsy, dementia with Lewy bodies, Alzheimer's disease. So I would say nothing has been more exciting, more dynamic than this whole area of sleep disorders with aging. And having had a very good dreamy sleep last night, I feel much more prepared for listening to this great seminar. So I will stop there, but huge thanks to everyone.
Thank you so much, Dr. Miller. We're grateful for you and those remarks. We hope everybody had a wonderful dreams-like sleep last night. And we're excited to learn about so much of what you referenced, Dr. Miller, including the intersection of sleep disorders and aging. So thank you so very much. Now we're going to pivot over to Tatiana Molayeva. Tatiana is an epidemiologist scientist based in Canada. She is an Atlantic Fellow for Equity and Brain Health from the 2021 cohort. And we're going to share more about Tatiana in the chat so that you can read more. And welcome, Tatiana. You can go ahead.
I need permission to share my slides. Thank you. I hope you can see my slides now.
Yes, we can see registration survey results as the cover slide.
That's perfect. Hello, everyone. Good morning, good afternoon, good evening. Thank you for joining us today for this session. So before I start, I would like to acknowledge you, people who registered for this event, by recognizing the importance of sleep equity for brain health. And our participants came from many countries, as you can see on the screen. Majority of people came from the United States. Thank you so much. But you can see how widespread interest is on topics of sleep equity in brain health. And I would like to show you your answers. Those people who responded to optional questions, those answers you see on the screen. We still have quite a lot to do in order to ensure that people across all global communities think about sleep health when they think about brain health and global health. So as you can see, many people who registered today had formal education on sleep health, and this largely came from people who are coming from the United States, but also other countries who work on the field of sleep health. But we still have quite a lot, 44%, who didn't have any formal education about sleep. And many people are not sure whether or not they have sleep physician in the country where they live. And also, they are not sure whether or not people have sleep facilities. So we need education to enhance knowledge about topics and specialists that work on topics of sleep and able to recognize health problems in people as they came about. But definitely, majority of people recognize that social determinants of health disproportionately affect sleep health. And those are qualitative feedback that came from you. Thank you for those who put of them. So Being deprived of adequate sleep compromises the ability to think clearly, subsequently make poor decisions, and put a strain on all bodily function. Sleep training is quite limited in low and middle income countries. We need to think about how to reduce knowledge gap. People would like to hear more about sleep and mental health. And when thinking about different people who are disproportionately affected by sleep inequity in sleep health, those people with lower socioeconomic standing, shift workers, had definitely much harder time to maintaining normal sleep health. So I will, as a scientist, and I'm sorry the image is distorted, and I probably need to somehow redo my slides because I cannot see it's properly loaded. But I will talk about science that came almost from 100 years ago. It was a report in Science on the effect of sleep loss. And as you can see on the screen, I put this report in a position of PICO, which is a mnemonic which stands for evidence-based medicine on topics of health-related issues. In this study that has been reported in Science, 8 students from George Washington participated in a 64-hour without sleep experiment. All of the students were males. Scientists compare multiple outcomes of these students from before, during, to after intervention. And what they found that after 40 hours of wakefulness, there were significant disturbances in sense and hearing. As people reported, fatigue increased, blood pressure decreased, and people's sight and hearing fell off. Mental state of 2 out of 8 students were also impacted. 2 students reported visuals that were not real. So understanding that we call now these visions as hallucinations. Performance, according to scientists who performed the study, was not safe. Driving was not safe, even though people were able to properly park their car. With regards to clinical work, a researcher found that after 40 hours of wakefulness, red cell blood decreased, hemoglobin decreased, white cell increased, but there were no changes to glucose level or other basic metabolites. When students were allowed to sleep, this acute state of sleep deprivation made students physically normal again. This study is not just to bring attention to sleep health, but also recognizes the impact of equity in evidence. As you can see, most evidence historically came from people who were males. So what is sleep? More than 100 years ago, sleep was regarded as an intermittent state between wakefulness and death, with wakefulness being regarded as an active state of all animals and intellectual function, and death of that of their total suspension. However, recently, we do recognize that sleep and wakefulness are endogenous, recurrent behavioral states that reflect coordinated changes in the dynamic functional organization of the brain. And that dynamic change is absolutely necessary to optimize physiology, behavior, and health. This latest recognition and definition through the National Institute of Health also recognizes that we can capture dimensions of sleep health across multiple levels, both physiology level as well as behavioral level and other lower level, including genetics. research throughout this year that has been accumulated tried to put all of these dimensions and create an ideal concept or framework on what sleep health is and what dimensions of sleep are expected to observe within the domains of brain health as well as general health of people. And they put all of this finding into 6 dimensions that they believe define sleep health. The sleep dimension were initially 5 dimensions, but recently additional dimension of regularity have been added. And this dimension include satisfaction with sleep, alertness, timing, efficiency, duration, and newer domain regularity. You can all try to capture your own sleep health on a continuum, and you will see that as you progress in life, you will have one or other direction or more direction affected more than others. So we need to consider this equity in each of this domain of sleep to ensure health for all. So this brings us to the topic of what is equity. Equity is defined by World Health Organization as an absence of unfair, avoidable, or measurable differences among a group of people, whether these groups are defined socially, economically, demographically, or geographically, or by other dimensions. And there are different levels of equity, as you can see on the screen. Some that we will focus today on are operating on macro and micro level, and some horizontal and vertical. And we will talk about this and invite you to participate in this session. So this brings us to the topic of health equity and how we look at these topics now. Health equity is a fair distribution of health determinants, outcomes, and resources between and within segments of the population where we live, regardless of their social standing. So let's look at some examples that I would like to share with you today with regards to healthcare access. And this, what you see on the screen, number of Canadians that are young people who reporting having a regular healthcare provider by province or territory. As you can see on the screen, people in some provinces within a country with publicly funded healthcare system has less ability to access for a healthcare provider on a regular basis. And this is not only because we have a capita of clinicians within these territories that are not the same, but it also recognizes that where these young people will seek care and whether they have an equal opportunity to access healthcare provider, do they need so? Those are just regular healthcare provider. When we think about sleep specialists, this discrepancy probably would be even greater. And
Tatiana, I just wanted to give you a quick time heads up. We're at time.
Yeah, thank you. I'm pulling out my slides.
Okay, well, wonderful. Thank you for going through the slides very quickly and for that rich information that gives us a sense of both sleep health, definitions of equity, and more. And we'll dive deeper into it. Sorry to have to cut you off, but just in the interest of time. So now we would like to pivot over to Sandra Jimenez, who is a co-lead for this session. Sandra is a neurophysiologist based in Spain, and she's an Atlantic Fellow for Equity and Brain Health as well, also from the 2021 cohort like Tatiana. Sandra, please take it away. And as we're letting you share your slide, I also want to mention that both Sandra and Tatiana co-lead the interest group on sleep from GBHI. So if any of you, especially from the GBHI community, are interested in joining that interest group, please do let Sandra and Tatiana know. They'd be very happy to welcome you to that interest group. Take it away, Sandra. Thank you. And I believe you're on mute still. Mary, would you be able to unmute Sandra?
Okay.
There we go. Perfect.
Now?
Thank you.
Okay, sorry, there was
We
something.
can hear you.
Okay, thanks for the introduction. Yeah, okay. So as we learned already that sleep equality is not the same as equity. So sleep equity is the state in which everyone, regardless of their condition, had an equal opportunity based on their need to obtain an amount and quality of sleep that promotes physical and mental well-being. But we all know that we cannot have all our the same opportunity to have a restful night sleep. As said before, some social, economical, and environmental conditions determines some sleep health inequities that affect the whole domains of sleep health that was previously explained, but also as other health disparities. So sleep health inequities affect impact with a major impact on those minorities, communities, or more vulnerable population, which they are likely to have worse sleep quality and worse and less sleep with more sleep disorders, but that, however, they have less resources for screen and treat them. Just a brief example of how some social determinants of health that were previously mentioned can affect the sleep duration. And in this slide, you can see how concerning the time that we work per week, so determines also the time that we are sleeping. And here in the left, you can see that as much as we increase the time or the hours that we sleep during the week, so also exponentially decrease the time that we sleep in contrast to those that are lucky and they can have less hours of working, so they get more additional sleep. In your right, you have also here how race and ethnicity differences affect sleep duration. Whereas white non-Hispanic individuals, they get in high percentage, around 65% of them get around from 7 to 9 hours of nocturnal sleep. Black non-Hispanic individuals, they get the highest percentage is with low sleep, nocturnal sleep, with less than 6 hours per night. So we see already differences in sleep duration regarding race and ethnicity. But more relevant is in this more recent study that underlies that these racial and ethnic differences in sleep duration could and can persist even, and were persisting in fact, during the 15 years that they were doing this follow-up. This means that African American Black individuals, they had short sleep duration along these 15 years and with compared, for instance, with the white non-Hispanic individuals. And again, these highest differences with concerning short sleep duration was for Black women, which probably may also affect the health disparities that also present this community. This is important because it has been shown that, as Dr. Bruce Miller was saying before, the short and long sleep duration are already known predictors, significant predictors for an increase in mortality. But not only this, so it has also recently shown that even could be differences, racial differences in the relationship between sleep duration and cognition. So in the left, you can see that whereas African Americans, those who sleep less, here in light green, if they sleep more than 6 hours per night, so they have the worst cognitive performance in all the cognitive tests performed. But this direction is reversed when explored for non-Hispanic whites. So in this population, those who sleep more, so more than 8 hours per night, so they get the worst test performance. So we will see that in the same cognitive test regarding the sleep duration, we observe differences between races. Since it was mentioned before that the sleep is a pillar for health, not only for brain health, but for general health, this implies that, especially for those vulnerable and minority communities, that they are systematically set up for getting worse health outcomes. So it's necessary to address the social determinant of health and identify barriers that block the access to sleep health care, especially in this more vulnerable population. And I would like just very briefly to mention 2 ongoing projects that are already going by the GBHI and Atlantic community in order to try to address these sleep health inequities. First is with a population with Down syndrome. So they are a population that they have a high relevance of sleep, a high prevalence of sleep problems. But however, despite they in society, they can access, or there is disponibility for treatment, equal treatment and resources, these sleep disorders, they remain underdiagnosed and undertreated because these treatments, they are rarely offered to this population because it's already presumed that they won't get benefits. Another sleep inequity that we want to address is to, in communities, in minority communities of women, and because in these more vulnerable communities in women, so they have poorer sleep health, but that may be less likely to complain due to the cultural roles or just like families' expectations or in their communities. So in this collaboration with other Atlantic fellows, we will try to explore the multi-levels that influences sleep to assess the sleep health inequities. First will be in minority communities in Spain, in Philippines and Ethiopia, and we hope we can extend soon this to other community fellows. So just to finalize in this brief summary, so we all agree that it's important to address, that we must address these sleep inequities, addressing barriers, especially to these more vulnerable communities. And as we will talk later, it's important that we educate the public and also the policymakers about the importance of sleep health, integrating into sleep into this conversation about health equity and social justice. Thank you.
Thank you so much, Sandra. That was wonderful. And you really enlightened us on how sleep inequities can lead to worse health outcomes and the particular concern that we all should have about for various vulnerable communities. So as we're thinking about this, I think we each can focus on and reflect a little bit on what can we each do? What is our role when we're trying to do this type of advocacy and awareness raising in our circles of leadership and of influence? So thank you so much. We're now going to pivot over to the equity perspective lightning rounds, and I will let, let's see who's going first. Sandra will be introducing the first group, and this truly will be lightning rounds. And for each of the folks speaking, we're actually going to probably reduce you down to 1 less minute for each of you. So thank you so much. We'll hop right into it. We're probably also going to skip the Q&A today, just in the interest of time. So thank you so much. Sandra, to you.
Okay, thank you very much, Camelia. And it's really a pleasure to start this panel discussion about global perspective on sleep health, equity, culture, vulnerability, and resilience and research implementation. And it's an honor to have our panelists. First, Emmanuel Penge, neurologist based in Democratic Republic of Congo. Grikis Peters, epidemiologist in the Netherlands. Sarah Solis, geriatric from Mexico, and ITC advocate for LGBTQ dementia disorder group live in UK and Brazil. So I will have the first question for Emmanuel. Emmanuel, so in the context of neurology practice in the Democratic Republic of Congo, what do you observe in access to sleep health service? So what steps can or should neurologists take to address concern of access to sleep care for advancing of both brain health outcomes and equity in health?
Okay. Thank you, Sandra, for your question. Can you hear me?
Yeah.
Hello.
Okay. Oh, we have you.
It's okay?
Yeah.
Yes. I would say that in my country, for the whole population, it's about 100 million, and we are here around 100 neurologists for all the country. And for the moment now, we don't have access to sleep training for physicians here in the country and also for the population. Apart from that, even for advice like polysomnography, we don't have even a single polysomnography for the whole country. So for me, I think it's very important because we have a lot of patients in my country who has insomnia when they come to hospital, but we used to give them drugs to treat them. And so as a neurologist, we have a plan to see how we can create some projects that will help us to give more access for education on sleep, and also to get some advices in order for us to have a better accuracy of sleep problems in my country.
Okay, that's great.
Yeah.
Thank you very much, Emmanuel, for your comments. So we move quickly now to, we will have them after for discussion, but we move now quick to Sara Solis. Sara, as a pediatrician working in Mexico, how do you consider multiple parameters, including those related to sex, gender, educational, geographical, localization, race, when developing a treatment plan for sleep in older adults? Or also in your opinion, how do you think these factors influence their sleep health and the ability to function for older people in your community?
Thank you, Sandra. Well, when we talk about sleep in the older population, we first need to understand that there are some changes related to age that they might reduce the time of sleeping, or it has so many changes in it that when we talk with a person about their sleeping, we need to understand that this thing is in the back, and we also need to see if there is a problem around it. Maybe a comorbidity, maybe some drugs, maybe other things. When we talk about sex and gender, of course, there are changes related to sex, but also changes related to gender, since maybe, for example, a lot of women in Latin America, they fulfill specific roles in which they postpone sleeping in order to be part of the community, and also with men. And when we talk about the educational level, well, sadly, it's more easier for people who have higher educational level to follow the plan that you make them, because it's better for them to understand and to see the benefit of it. So that's why we also need to invest in educating the population, to tell them, hey, we are doing this for you, and if you do it, this will help you to improve your sleeping. And with the location, of course, if you live in Mexico City, the sound is going to be crazy. But if you live like in rural area of Mexico, it's going to be way better. Also with contamination, it's way better. And I think Latin America, it's very similar. And so there are many factors that we need to take into account when we're making a sleeping plan for people. And I think that these factors need to be culturally adapted. So it's not the same to create something for someone who lives in Europe to someone who lives in Latin America. So it's tricky.
Absolutely agree. Yeah. Thank you very much, Sarah, for your reflections. And we will discuss after. And we move now to Giske Peters. And so Giske, as a scientific in the Netherlands, how do you think the sleep priorities identified in this STRAP program will shape global research, policies, and practice? What do you consider will be the most important area for advancing our understanding of pandemic-related changes in sleep among people with dementia and their care living at home during the pandemic as well?
Thank you, Sandra. I'll quickly share my slide because I think the picture will tell half the story. So what we did in the STRAP consortium is that we shortlisted 39 topics, consequences of the COVID control measures, and we based on literature research, and then we asked people with dementia, their care partners and healthcare professionals to prioritize these topics, these 39 topics. And from that, we derived a top 10 list of priorities. And interestingly, the people with dementia ranked sleep and sleep problems as the top priority. Sleep was also identified in the top 10 lists of the care professionals and the care partners. So all three stakeholder groups identified sleep as a very important issue. But we have to see this in the context of the survey and the question that we asked. So we asked people which priorities which topics they think should be prioritized for future research to improve the situation for people with dementia in times of a pandemic or other type of crisis. And I think sleep fits nicely in the theme of physical health and daily routine, because people also prioritize changes in diet and eating patterns and worse physical health and disrupted activities. So sleep could be affected because the COVID control measures disrupted their daily routines and therefore also their sleep. Or it could be that the COVID control measures affected people's mood and caused a lot of worries about the future, about their health, about their partner's health, and that may have also contributed to the sleep problems. And our recommendation in the research agenda is to that we need more research around the mechanisms, understanding how these control measures affected these topics, including sleep. And then the second strand of research will be around interventions. How can we mitigate these negative effects? And then education and information is also really important to take away the worries that people had around the control measures and how they affected their lives. So that's it in a nutshell.
Okay, Giske, thank you very much for your comment and reflection. This was really amazing. And the last but not the least in this panel, so we move to Daisy. And Daisy, as a global advocate for gender, non-binary, and transgender individual worldwide, what do you think is the top priority related to sleep health that will improve the lived experience for transgender and non-binary individuals with dementia?
Thank you, Sandra, and thank you to everyone at GBHI for the invitation to join you today. I have a cold that I caught. I was in Krakow last week at the Alzheimer's Disease International Conference, which wasn't very welcoming for trans non-binary people, but I'm glad to know that GBHI is. But anyway, barriers to sleep health. for trans non-binary people include minority stressors such as discrimination and social exclusion, which contribute to higher rates of sleep disturbances among trans and non-binary individuals. Moreover, transphobia within healthcare systems exacerbates these barriers, leading to mistrust and inadequate access to culturally competent care. To promote sleep health, we must prioritize cultural competence and inclusive care practices. Creating safe and affirming environments within healthcare settings is essential to foster trust and comfort. And additionally, community support and advocacy empower individuals to demand equitable access to healthcare services. In conclusion, sleep health is compromised by transphobia and minority stressors, but inclusive care practices and advocacy efforts can make a difference. Everyone deserves the opportunity to achieve restorative sleep and enhance their quality of life, regardless of their gender identity or cognitive condition. And I'm finished now, but I want to thank specifically you, Sandra, Laura Bowie, DeGibril, and I think maybe Stacy, for putting your pronouns on screen along with me. That is a hugely welcoming gesture that is culturally competent and inclusive. And we all know it's not rocket science. There's 49 people on this Zoom who could have done that same. And I'm so grateful to you for doing it. Thanks and good night.
Well, thank you very much, Dahi, for sharing your perspective from a life experience point of view. And thank you all, these panelists, and we will continue with our webinar.
Thank you, Sandra, and thank you, Dahi. Also from your lived experience point of view, much appreciated. And now we're going to pivot over, wonderful. We're going to pivot over to Tatiana for the second round of lightning perspectives. So Tatiana, please go ahead and introduce this next exciting round. Thank you.
Thank you, Sandra. Thank you, panelists from panel one for your perspective. Really greatly appreciate it. And I would like to introduce panelists from panel discussion two, who are amazing leaders on topics of equity in brain health, who came from different fields of study. And first on my list is Mick Kelly, who is an artist and Atlantic Fellow from 2021 cohort. I would like to also introduce Laura Bowie, gerontologist who is Canadian but currently lives in the United Kingdom, who is Atlantic Fellow from 2018 cohort, and Salman Daria, who is a clinical scientist, Mongolian, who is an Atlantic Fellow from 2021. And I have topics around integrating sleep and brain health into design and diplomacy. And my question is to Mick. Mick, in your opinion, is it feasible to enhance global equity in sleep health and brain health through accessible design principles? And if so, what innovative strategies can you share with us today that could be integrated to foster sleep health and brain health for all people? Thank you.
Thanks a million, Tatiana. How are you? Yeah, I have kind of three observations I wanted to sort of look at. And one of them was housing and habitat, homelessness, and dreaming, and the importance of dreaming. So, you know, much of my work is about how we produce space. And I think space is not something that we think of as an empty void we fill with objects. I think we produce space. And by that, I mean we produce spaces potentially that are good for us. We create hospitals and prisons which do very different things. So you might kind of think the idea of architecture and design, it depends. It depends on regions, depends on context. that require different kind of design strategies to respond to local customs, geographies, climates, and contexts. And we might think about these in terms of elevation, warmth, coolness, light, dark, and humidity. And so I would give an example of Alvar Aalto, a Finnish architect who designed a louvered ceiling in a hospital sanatorium. And the idea behind this was to create a ceiling that was stimulating and moved with the flow of the ceiling, like creating a journey in a hospital, given that patients would spend long hours on beds looking up at ceilings, probably false ceilings suspended and lights. And I think this was a really inventive strategy on how to create a place of rest for somebody with the potential of creating sleep, which I want to come to later. And so the other aspect, I think, was that this is a sort of a space that accommodates, if you like, sleepfulness and dreaming. Whereas I think, on the other hand, I wanted to look at the question of homelessness. And on average, a homeless man and woman sleeps approximately 3 hours per night. And that must have a huge kind of consequence on the Canadian rhythm, the immune system, and must have a huge strain on bodily functions. And I would imagine then, how would one think clearly? And I apologize, I'm looking this way because my camera is over here. But like, it must have a real strain on how the body functions and how one would think coherently about living when you are deprived of sleep. And so from going from housing and habitat to homelessness are very different things. But I do want to finish on, if you like, more not a point of celebration, but a one of aspiration on the importance of dreaming. And I think dreaming is really, really important in how we sort of, if you like, process our anxieties, we kind of process our fears and maybe even our best creative selves. And so the mechanism of dreaming is so important that it deals with the unconscious conflicts of desires. Dreaming helps us deal with scenarios we don't give ourselves permission, if you like, to deal with in our rational state. Unless you're a Republican, I think there's an exception there. So I kind of think art galleries and museums are important spaces that can kind of deal with the non-verbal way we cannot speak, hear, or say about things that are presented to us. And I think these environments really foster the possibility of good brain health. And the image I showed you here is of Matthew Barney Cremaster Cycle. They're 5 feature-length 90-minute films dealing with the cremaster as a concept, as a starting point to imagine and to dream about the idea of humanity that may be kind of non-gender or post-human, if you want to think about it in this way. So I think his work, and I've taken 3 images from 3 different films to sort of sandwich together and think, how do we, in a dream space, create a way of questioning, are we genetically hardwired to think a narrative in such a coherent, rational way? Or if imagery is presented to us in dreams as a way of imagining other futures of ourselves, what might that look like? And how might we kind of, again, I kind of use the word reservedly, celebrate the possibility of dreaming as being a really important state of I suppose, accessing or dealing with those aspects of our lives that we probably edit out or prevent ourselves from thinking about. Okay, look, I'm watching the clock. I'll stop there if that's okay with yourselves.
Nick, thank you so much. I think your talk enriched each of us tremendously and brought attention to this important and probably empowering power of art to distort any inequities in sleep health, and brain health, and unite it all as a level of the humans. So now we would ask Laura, who is a social gerontologist, to talk a little bit on answer to the question in line of the following. What is the role of sleep diplomacy in promoting equity in brain health among different people and populations globally? And if you think of any strategies that you can share with us today, that would be of great value. Thank you, Laura.
Thank you. You can hear me okay, right? Perfect. I just want to say that going from talking about dreams and art to talking about diplomacy and governmental policy isn't really the switch I would normally want to do, but here we are on this panel. Because there's limited time, I'm going to share the very short 3-page paper about sleep diplomacy in the chat. And to answer your question, Tatiana, how I understand sleep diplomacy and brain health diplomacy is twofold. First of all, it's awareness in the population to look at what is health literacy, what is sleep literacy. And then the flip side of that is really holding our politicians and policymakers accountable. So one idea that the brain health diplomacy team has developed, it was Dr. Walt Dawson, also 2018 GBHI fellow, who had this idea, was to develop something like a brain health charter or a brain health treaty. And for sleep, we could go so far as to make a sleep treaty or sleep charter. So right now, if you look at the Gap or you look at Lululemon or other companies online, you can see on their websites, they have an anti-slavery charter that they all sign up to. What if different organizations like healthcare systems or pharma companies, anything like this, had a charter that they had to sign up to say, we understand the importance of sleep for our employees and the populations we care for, and we're going to sign this charter. And if we created something like that in the diplomacy world, we could see leaps and bounds for sleep health. But that will be all of me now. I've taken 90 seconds. So thank you very much.
That's fantastic idea. Thank you, Laura. And now to our last panelist, Salma Daria, who is a clinical scientist. And the question is, considering the importance of sleep health for brain health, what is your belief in your country, the most urgent priority for addressing any inequities in sleep health and brain health? So anything you can talk about will be appreciated. Thank you.
Thank you, Tatiana, and thank you, everyone. It's a wonderful discussion that I'm having. And just to echo on our previous talks, like Sandra explained how sleep is different in different races and ethnicities. So based on this is very important to also elaborate or think about how is it different culturally. And from the Mongolian perspective, we do have sleep centers at the Mongolian National University of Medical Sciences and also a sleep center at the private clinics. So there are centers, but for me, what the main thing is to address how we're going to mobilize those centers so people will come. And just like Laura mentioned, the main thing is just to raise public awareness regarding the sleep. We have learned a lot from the public health measures in the last decades, how we're battling with the obesity and smoking. So sleep would be another thing that we could raise awareness and say that the sleeping is the risk factor for many diseases that are to come. So this awareness will help people just to care about their sleep and talk about it. And regarding on how to use and facilitate healthcare system as a clinical scientist and working in the field, and with the innovative system that we have now, such as an electronic health records being available for the doctors to to collect the data from the patients, I think it is very important to standardize the measurement or the anamnesis procedure in the clinical setting, like a primary health cares, so the people will have their data regarding the sleep. With this information, we could use all of this data mining and to really address the question, what are the problems we are having? Because we need to define it. What is the sleep thing happening in Mongolia? And I was happy to learn that in Mongolia, even isolated country, we're still using these innovative systems, and we're also having integrated the electronic health records. And from my side, I also thinking of doing this and to advocating policymakers to include the sleep guidelines and sleep measurement questionnaires in the guidelines in the clinical practice for the healthcare practitioners, so those people can use those health centers, sleep centers in Mongolia. So this is a very interesting discussion, and I have learned a lot about you. And At last, I would say that international collaboration, like we did in the GBHI in the field of the dementia, I think we can still do that with dementia, with sleep, with everything, with art, with being inclusive of elaborating all of the things that the world has changed and integrating. So this is very important, and I hope we will go further and talk more about sleep. Thank you so much.
Thank you. Thank you.
Okay, thank you so much, Tatiana, and to all of the panelists. We are so grateful, and we are going to quickly pivot over to Dr. Brian Lawler, who is going to close us out with some reflections. Dr. Brian Lawler is a professor of old age psychiatry at Trinity College Dublin and site director of GBHI at Trinity. He is a geriatric psychiatrist with over 30 years working on developing services and delivering care to people with dementia. So Brian, if you can close us out, we really had a grand tour across the globe with these lightning rounds. And I think the beauty of GBHI is that we can go from dreams to policy to the intricacies of science. And I want to do a special shout out to the 2021 cohort who is so well represented on this session. Brian, to you. Thank you so much.
Great. Thanks, Camille, and thanks to everybody. So there's so much for me to reflect on, and as Mick said, for me to dream about, actually. So what did we learn? We certainly learned about the importance of sleep and sleep inequity, how important sleep is for cognition, for emotion, for our brain health. I learned you can have too much sleep and too little sleep. Like the sweet spot is somewhere around 7 hours. Is that right? But let's talk a little bit about inequity in sleep, because that's what was the focus. And we learned about the relationship between sleep inequity and time inequity. So people who have too little time, who are overworked, have too little sleep. Also, people who are part of minorities, their sleep is affected. They have inequities in sleep. Those who are marginalized, and those at risk groups. We heard about people with Down syndrome, caregivers, people with mental health issues, people with dementia. All of these at risk groups have sleep inequities. And also with regard to sex and gender, particularly Black women seem to have very, very poor sleep inequity, or sleep inequities, problems with cognition. What's that related to? Probably related to time inequities, caregiver status, many, many issues, all of which increases their risk of developing cognitive decline and dementia. So we need to have the conversation around inequity as it impacts health, but also how it impacts on sleep. That must be part of the conversation. I was really very interested to hear about the impact of space and environment and climate change on sleep, and how it's driving sleep inequities around the world. The impact of noise pollution, housing conditions, homelessness, all of which are impacting on sleep inequities. Climate change and these high temperatures, again, affecting sleep inequities. And finally, I come to solutions, and we heard through the panel discussions some interesting thoughts on what we need to do. We heard about the importance of caring, about inclusion, inclusive care as a solution to sleep inequities, better awareness about sleep and sleep issues. I was intrigued by the idea of a sleep charter. And we know that the more work, the less sleep. Maybe we should apply a sleep charter at GBHI. That would be something interesting. Sleep as a public health issue. I heard that referred to, and I think that would be an interesting way to go, to take sleep as a real public health issue, because it is a public health issue and a significant issue for brain health. So I'd like to just thank Sandra and Tatiana and the panelists for just a wonderful webinar. I've learned a lot, and I hope we will come back to this. And thanks to Camelia and to Mary and to Elisabetta for pulling this together and for all their support. So I'll hand back to Camelia, I guess.
Thank you, Brian, and we're grateful to you. And again, I want to thank so much Dr. Tatiana Molayeva and Dr. Sandra Jimenez for your incredible organizing of this session. Folks, thank you for being brisk and speedy as we absorbed so much together. Our organizers are going to stay on for about 5 extra minutes. We recognize we're 2 minutes over because we started a little bit late. If any of you would like to stay on to talk to Sandra and Tatiana, please do stay with us. We will be here. I will also stay. And just thank you to all of you, and acknowledging the beauty of this GBHI community that makes this interdisciplinary discussion possible and gives us hope for the future in terms of where we can go with sleep health equity. Thank you so much, everybody. And we can also stop the recording. As folks are leaving the webinar, what you're listening to is a special lullaby from Laura, who is one of our current fellows, Laura Maria Calderon, in fact. She writes lullabies hand in hand with refugees who are in Greece. And so that is what you're listening to here, is a beautiful lullaby that she's singing.